To talk a little bit about uterine biopsies for abnormal bleeding. This is really becoming a problem. The American College of Obstetricians and Gynecologists last week now recommend that virtually all women who have any bleeding in menopause have one of these painful endometrial biopsies, regardless of how thin and distinct their endometrial lining is on vaginal sonograms. This is a real problem. First of all, the nomenclature. You know, people use the word biopsy. Biopsy is an incisional biopsy, an excisional biopsy. Sampling is when you take something that's representative of the rest. For instance, if you take a water sample from a reservoir, you assume that it's indicative of the entire reservoir. When they do these so-called biopsies of the uterus, that's blind sampling. It's not truly a biopsy. And there's a lot of science that shows if an abnormality, whether it's a cancer or a polyp, occupies less than half of the surface area of the uterine cavity, these blind sampling biopsies are fraught with error. The false negative rate of this sampling ranges as high as 33% in women who have known cancers, where they went ahead and did one of these biopsy samples either in the OR before their hysterectomy or in the clinic the week before their surgery. The so-called false negative rate of these biopsies is much, much higher than the false negative rate of a well-performed vaginal sonogram. This is really, really problematic. I'm very concerned about what the American College of OBGYN has decided to make its new standard.